Hello, good evening. This is Dr. Fasikawit from EDPA. I'm currently the Vice President of EDPA since Dr. Abdullah has technical difficulty. I'll introduce Dr. Maria for now and he will get back to it when he has resolved the technical issues. Just to give you a brief overview of Dr. Maria. Actually, she's a dear friend of mine and I think she's a very good professional to aspire to be. She has done her master's degree in global health in Bergen University, and now she's pursuing her PhD. So I think she has a lot of detailed information about mental health among dental professionals. I would like to welcome Dr. Maria to the stage. Thank you very much.
Thank you, Dr. Fazikawit, and I'm happy to be here. I'm happy to see most of you who have managed to log in. I'm just trying to first put my face there before I remove it because we don't want to have issues with the internet regarding my video. But I'm very, very excited to be part of this Pan-African webinar, especially in dentistry. And let me just introduce myself a little bit more. Yes, we've met with Dr. Fazikawit and a program that I was being sponsored for my master's at University of Bergen, where I was pursuing my master's in global health. I also have a diploma in global oral health as well. And now from the same university, my first degree was at Makerere University in Uganda, that is Bachelor of Dental Surgery. And currently now I'm pursuing my PhD with University of Western Cape, based in South Africa. And I'm just at the initial stages of proposal development. The topic I'm working on for PhD is actually exosomal cargo as diagnostic biomarkers in oral squamous cell carcinoma among the Ugandan population. And it's basically more of a molecular study. But today I'm not here for molecular business. I'm here to talk about the mind, especially our mental health as dental care providers. So good evening to you all. I know that Uganda, Ethiopia, our accents are a bit different. I'm just hoping that we can understand each other. And at any one point, if you can't understand my accent, please feel free to ask the question again. Yes, so to kickstart, the title of today's presentation is Mind Matters. And basically that is discovering mental health well-being among dental professionals. And why is this topic? I know most of us may be surprised, but this is something that probably we've not really tackled a lot. But also because personally I've struggled with mental health at one point of my studies and also as a dentist, and I realized that this is something that had never been taught to me all the way from my first undergraduate degree all the way to this stage. But alongside, as I was doing my master's, I happened to also do occupational health. And that's where I realized that we as dentists, as dental professionals, really have to take care of our mental well-being. And that's the reason as to why we're sharing this. Today is a very sad day for Uganda because we've lost a colleague. And so it may be a bit of a somber mood, but at least we are here to make our lives better, but also make sure that we're in good state, take care of our patients. So that is that about me. We are now going to delve into the discussion that we are going to have. Probably at this moment in time, I would request Dr. Fazika, is it okay remove now the video so that in case people are rather struggling with the bandwidth, it's easier for them to access. Is it okay remove the video? Okay, thank you. All right. So let's start. Okay, I'm a Ugandan, I've mentioned that, and I'm also part of the Uganda Dental Association. I'm the publicity secretary. And this is a very good collaboration for us to be working with the Ethiopian Dental Professionals Association. I'm also holding a role as the National Liaison Officer for the Uganda Dental Association with FDI. So you realize that part of the concepts I'm going to share today are also going to involve a little bit of what the FDI right now is talking about mental health and our profession. So Uganda is known as the Pearl of Africa, and just to show you some pictures, basically what you see here is a picture of me at one of the deepest lakes we have in Uganda. It's actually the deepest. It's called Lake Bunyonyi, and it is having it has a lot of avinatural species, which are about 200. We also have 29 islands, and also there's a lot to see in Uganda. I trust that Ethiopia is a bit in the proximity, so it's easy for you to come and visit us, as we also plan to come and visit Ethiopia. Yes, so, and this is one of the hills in the western part of the country. We had gone for dental outreach. So just to show you that other than oral health, I mean seeing patients in the clinic, we also try to go and do outreach as the Dental Association. So this was a team of Uganda Dental Association members, and we had gone to do oral health treatment under an FDI grant that made us go to the western part of the country. All right, so what we are going to deal with today are going to be working definitions. We're also going to talk about the sources of stress, then the physiological manifestations of stress, then the solutions to stress management, tackling mental health as an individual and also as the organization. Because I trust that some of us here own dental clinics, dental practices, so a little bit of also information there. There is also part of the national kind of tackling, but I thought that probably when we first deal with the individual and the organizational level approach, we shall be able to tackle that of the national at a later point. All right. So the first thing I put here is that a boil that eventually becomes a cancer. Where did I get this from? So when I was doing my master's, I sort of started now battling with how I was reasoning, thinking, but also I was extremely anxious and I wasn't able to balance all aspects of life. And I met one of my friends who was from Bangladesh, and I sort of tried to share with her what I felt at that moment in time. And then she told me, look at this as a boil. Manage it when it's still a boil before it becomes a cancer. So this is where this term comes in. So we as dentists, we struggle a lot. I'll put maybe dental professionals. We struggle a lot with so many things, but we don't know whether we are really going in that lane because we are not even aware of what is happening to us. So mental health starts as just anxiety, you getting worried about your procedure, getting stressed about what is going to happen in the day. Probably there's that patient that you feel you didn't do a great job, and maybe they called you over the weekend and it's on your mind. So basically that's how it starts. Later on, it progresses into a serious mental health issue that could even become an addiction. In my introduction, I missed out the part that I'm also teaching undergraduate students at Makerere University, one of the universities in Uganda. And we know that students really battle even with stress at the level of their bachelor's degree. And so that literally tells us that this is something that we cannot ignore. And of course, most of the addictions that we are finding among dental students are coming in as a result of poor management of stress. An addiction can move all the way to even going into drugs. For me, when I got, my addiction was funny because I started taking a lot of chocolates. And maybe the hazard, what I basically ended up getting is the first cavity in my mouth because I was trying to battle stress with chocolate. But of course, we have a lot of mental health issues that happen when we don't manage these small things. We call them small, but they actually become cancers later on. So after getting serious mental health issues, you then progress into poor quality of life, and eventually we have a very miserable send-off to the grave. And that's why it becomes very important as we try to get to know all that we have to do to make our practice better. It's very important that we also get to know how to manage our mental health when things get so tough, because it's something that has been ignored. And unfortunately, even we have very few studies that have been carried on among the African population regarding mental health and the dental profession. So this is more of something to spike you off, to also those who are in research to start digging deeper about what's happening in Ethiopia. Also, we as Ugandans, we are trying to make sure that we also find what's happening on our end. But it's basically us to change our states of our day-to-day living, our practices, but also be sensitized about how you can make money but die early because of poor management of your mental health. All right. So the working definitions we are having one is what is mental health well-being. In the process, I'll ask some questions and I'm going to request you put your answers in the chat. And then I would request maybe, since Dr. Abdallah is having an issue with his microphone, I'll basically ask Dr. Fazikawi to tell me some, like the balance in terms of what people are responding to the questions I'm going to ask later on. So mental health well-being is basically a state of well-being that enables people, one, to first of all realize their ability. As a dental professional, you're supposed to know what can you do, especially to change people's lives in terms of their oral health system. But also as a dental professional, you're supposed to be able to cope with life stresses. When you're having so many things happening around you, probably a lot of a workload in terms of patients and also the staff in case you have your own practice, and being able to also cope up with also family, you realize that it's a lot. So well-being means that you also have to be able to cope with other life stresses, but at the same time also work productively and contribute to your community as an oral health profession. Most of us, we struggle because we do a lot to manage other people who are our patients, but forget about ourselves. And that's why we are draining in so many things happening. You find that someone, before they go to a practice, they have to take a lot of alcohol, or they're trying to balance and taking a bit of this the smokeless tobacco as they're trying to work, so that maybe they have a lot of energy levels to deal with the so many patients that are coming in. And that is already something that is happening in more of a private, but in the long run, it's going to affect us and our productivity as we manage the patients. I always tell students, I mean undergraduates, that actually it's only a live person that's able to treat a person. Once you're dead, you're not able to see your patients. Maybe they'll talk about a lot of good things about you, but you will not be able to, be in position to continue offering these services you've been offering while you're still alive. That's why it's becoming very important for you to actually take care of yourself before even you take care of your patients. So most of the dentists also go through what we call a burnout. And this is a state of mental, physical, and emotional exhaustion that is caused by prolonged stress. So whenever stress is not handled early, it basically keeps on draining the person until at a point whereby they're actually unable even to work productively because of the late recognition of the burden the stress has caused onto their bodies and their entire systems at large. So before we go to the next thing, I just want you to write in the chat. I'm only going to give you 1 minute. Write in the chat one word to define what mental illness is. When do you know that you're probably not mentally okay? Just one word you would mention. So you can put those words in the chat. I'm excited to see what you think mental illness is to you. Just one word. Just put it there. And I see. Let me see any that I'm seeing as yet. All right, I'm not seeing anything. Are people writing what they think mental health is to them? I mean illness, just one word to describe. At least if I have 3 responses, I'll know that there are people are really following. Okay, I'm seeing depressed, forgetting. Any other? All these are very good answers. At least if I have one more, we can proceed. At least I'll know that people are close to their phones as well or their gadgets. Just one more response. What do you think mental illness is? Yes, anxiety, depression. Good. I like the answers here. Okay, at least it's showing that something is happening. All right. I don't know who is the host, but we have people writing on the screen. So probably that ability should maybe be deactivated. So we have depression, tired, and isolating. Yes, this is very interesting. So I'll stop there reading and then we proceed and see how most of this is working. Let me check. Okay, let me just minimize this. All right, so we are not very far from that. Let me just see what we have here. Okay. Yes, so these are some of the answers that were raised when people asked about mental illness. So depressed has come also from our discussion. We have loneliness. Someone has talked about isolation. We have hopelessness. We have sadness, problems. Someone talked about forgetting, which is also one of those things. And then we have displeased. We have loss, and then breakdown, anxiety. Someone has mentioned anxiety. So all these things can define what mental illness is. And of course, we have stress in very big letters, and depressed coming out also in sort of a big kind of a font. And we are seeing failure, we are seeing sick, all those unhappy. So all these are things that can actually affect our mental health well-being. And so these are things I want us to know if we really know. One is that did you know that actually 50% of the dentists have considered leaving dentistry for personal well-being due to stress and job pressure? Recently, I was attending a conference in Hungary, and I got to know that one of the presenters, I've forgotten his name, said he actually lost his first marriage because of his job. So this is something that can also tell us what really happens, and we don't really know that it's happening until it puts us down. In the UK, 87% of the dental practitioners have actually reported to suffer burnout. In the middle income countries, it's about 32%. And of course, we also had even 5% of the dental nurses having experienced mental health issues in 3 years. That is in the UK. And I know most of us also work with a full dental team. So we not only think about ourselves, but even the people that we work with. In Canada, we have 44% more females than males being affected. And whereas we also have elsewhere 50% and versus 37% in kind of comparison. And when you look at this, of course, women have a lot of more issues, even regarding family, regarding a balance and other things. You have to probably get pregnant, give birth, and a very good family, attend to your profession, see patients. So the work-life balance there becomes a bit difficult for females. And then the question is, what happens in Uganda? What happens in Ethiopia? These countries actually do not have any studies as yet regarding mental health of dental care providers. So this is an eye-opener for both associations to look at this with a lot of interest, because it's something that is still virgin our end. The studies that have been done in Ethiopia have actually been on dental patients, but none on dental care providers, which is worrying, because then we don't have the statistics to compare. Neither can we even set a bar to help we ourselves become better practitioners living healthily, because health does not only mean physical, but also mental well-being. And so this was a newspaper that was published in Uganda early this year. And it was talking about Uganda being a happy or unhappy nation. And one of the things that was stated, I've seen some people from also Tanzania, I'm not sure I've seen a panel from Kenya, but Kenya was recorded to be the 18th most happy country. We don't know the scale at which they're basing happiness from, and Uganda was the 19th. I didn't check out the Ethiopia where it was lying. But of course, Somalia was in the 24th position, Tanzania was in the 33rd position, and Democratic Republic of Congo was in the 37th position. As happy countries, we are going to talk about what happiness means, because we may not really know what it means to be happy. But one of the things that they pointed about Uganda is that it has 78.8% of social support, and then there is 81.4% of freedom. Of course, this was just a newspaper. It's not science. It's not like researched, that it has a lot of evidence to talk through. But we are going to find out these aspects that were brought out, how important are they in our profession based on the countries we are coming from. And this takes us to the question. I know majority of us are coming from Ethiopia, and this is the first question. I'm going to really request some answers from this in the chat. So one, do you think Ethiopia is a happy nation? That is the first question. Let me get some answers. Do you think Ethiopia is a happy nation? Because before we talk about individuals, we have to see whether the systems around us favor. So people from Ethiopia, I'm waiting to see your answers, whether you think you're a happy nation. Okay, I'm saying I don't think so. And someone has written yes. That is Dr. Temam. Can I have a third answer? At least I need a bit of 3 responses. No. Okay, we have a no from, I think, Dr. Kaba. Yes, so we're having these answers, and they are quite interesting because they're leading us somewhere. And this is what you're going to ask yourself at the end of this presentation, that you as a dental practitioner working in Uganda, because I know some Ugandans are here, working in Tanzania, I've seen some Tanzanians working in Ethiopia. I've seen, of course, Ethiopians are the majority. I'm seeing another answer of yes, and that is good. I'm liking these responses. So you're going to ask yourself, you as a dental care provider, are you happy? After the end of this presentation. This one, I don't need the answer right now. Okay. So we are going to ask ourselves, why is this topic becoming very important among the dental care providers? And why is it an essential part of occupational health? One is that, first of all, stress is a natural response to challenges or threats that can cause physical and mental tension. So why do we have stress among dental care providers? One, it's basically a failure to balance between work ownership, that is practice ownership, and also patient management. The other challenge the dental workforce faces is basically management of the work team. We know that none of us works as an individual, we work in teams. So the failure to manage those teams also becomes a challenge. We have also heavy workload. There are a number of patients that come in complaining with dental issues, and sometimes you get overwhelmed, and that also breaks you down. You want to make the money, but at the same time, also the body is being strained beyond its limit. Then thinking about those blocked root canal experiences while in your bathroom. So you go home and you carry whatever you have seen in the day to your home. For example, you are working on a root canal and you found those very curved canals, and somehow it has affected you all the way to your home. So already this is starting to drain you subconsciously, but it's already coming in. Difficult patients. While I was attending one of the FDI congresses, one of the professors mentioned that you'd rather work a difficult case on an easy patient than work an easy case on a difficult patient, because the stress that comes in after becomes really very difficult. And for us who are still young in the profession, this is very important for you, because this is what young dentists also face at the start of their practice. They realize that people are, first of all, undermining your competency, because when you leave dental school, you're quite small in physique, and someone is still also questioning whether really you can even remove a tooth. And so this all comes in even at that early stage. Of course, when we grow and get a lot of experience in dentistry, maybe this reduces, but does not take away the fact that we still get difficult patients, even when we've practiced for over 20 years. Difficult procedures will always come through, but also difficult dentists, because some practices where we work with a number of us. So sometimes you can have those clashes with your fellow dentists, and also that becomes a problem as well in management of stress. So we want to first of all understand what are the physiological manifestations of stress. When do you know that things may not be right with you? I've always had some difficult patients on my schedule, and each time I see that they are coming, my heart is pounding. Coming in from the faith perspective, I even have to pray that that day the procedure goes well. So there are so many things that happen. So just even a pounding heart, when you're showing up to work, is already a sign that something else is not okay. A racing pulse. Sometimes the hands get excessively sweaty because we have a lot of production of adrenaline as well, especially for fight and flights. All those things happen when you're getting stressed. Even butterflies in the stomach, that is a sign of also anxiety, especially when you're having a difficult case. We also have feelings of muscle tension, whereby you feel we have a lot of sort of ergonomics in dentistry. And once we don't handle those well, the body gets fatigued. Recently, I saw somewhere of what a dentist looks like, and they had like a hatchback because of the bending we do. And of course, the strain it brings onto the shoulders, to the neck, the upper back, the lower back, and even difficulty in breathing. All these come in as manifestations of stress. And then burnout, that is as a result of prolonged stress and failure of the body to cope, can also make us feel fatigued and tired all the time. Someone mentioned being tired, insomnia, you start losing sleep. You think that probably, no, I've just been so busy, but actually in the long run, it's because you're ideally not you're not listening to your body. You're not listening to your brain and your mental health. It's actually saying something is not right. But often we ignore. You also have inability to focus and engage. One of us mentioned something about forgetting. You become very forgetful. You don't fulfill your tasks as you're supposed to. Someone talked about isolation. This is also one of the things that happens to us. You start isolating even from your own family. You realize that you have very low energy levels, both inside and outside the practice. You're struggling to see patients. You're getting very easily agitated. You've actually started exchanging words with your patients because whatever is happening is actually killing you inside, but even the customer care delivery to your patients being affected. Loneliness as well. Feeling overwhelmed because there's too much going on and probably you can't really see how to manage it. Of course, also procrastination and delay in getting your targets done. So how do we cushion our minds from stress? The first thing is, one, we as dental care providers have to plan. We can't re-emphasize planning, but planning is very important. Planning our days all the way from the time you wake up, having a scheduled kind of system. You know which patients you're going to see and what you're going to do for them. And at the same time, also, we learn to delegate. Often when you're starting your practice, you're the owner, you're the business person, you're the cashier, you're the receptionist. You're trying to do everything on your own. But later on, you realize that once you've started getting people coming through, with so many patients, that's when you have to start delegating tasks. Employ people to help you offset this burden. Because in the long run, you're going to end up closing that clinic. Why? Because there's too much going on, and probably you're handling everything as a one person's army. Also, the other thing is when speed hits up, it's time to slow down. It's not, I always say, it's not demonic to go for a vacation, to relax. It's not demonic to request for an off day so that you can set your things in order, because the patient needs the good you in a good mind, a state of mind to deliver quality service to them. That's why you have to take care of yourself. And also live work at work. I put there this picture because this picture was taken 6 years ago. We had gone to visit hiking. And in this picture, I'm the only dental profession here. One of them, the one in the middle, is actually from Zimbabwe. She's into public administration. And the other person is actually from South Africa, and she's into psychology. So you realize that we are very different people, but we hang out together. That's why I said live work at work. Also make sure that you don't carry your work friends with you. It's always good to have a variety of people in your circle, because if you carry dentists out of dentists, if you carry dentist friends and quotes out of the workplace, you're still going to end up discussing the same points about those failed root canals in your free time. So your mind is actually not resting. So that's why we encourage that you actually get friends outside the dental profession, but also prioritize your family, because family is the people you're going to go back to after a heavy day, a day that has been very hectic. You go back to your family, and also be intentional with your time off. If you request for a time off, don't go back and start reading how to give an inferior alveolar nerve block. Don't go and watch videos on how to tackle a mesiobuccal canal that you cannot see. Don't go and watch videos on how to, maybe all these things about the profession. Like, you be intentional. When you're off, leave all work out of the business, meaning that allow your mind experience the other aspect of life other than your patients, other than the dental procedures. Exercise and be fit, because you spend 90% of your work time sitting in the dental chair. So fitness, ergonomics becomes very essential for a dental care provider. And of course, I mentioned that when you talk about family, you realize that later on that family needs a lot of your time. Because when things fail at work, you should have a place to go back to. Now you have no place to go back to. That's where isolation is going to come in. And that's how mental health issues disturb the professionals, and they end up taking addictions as sort of something to cope up with. Why is it very important for you to manage stress at the early stages? One is because when you're stressed, it will be reflected in your output. You're working to make sure that you provide service, but also to earn out of that service. Whenever you're stressed, you're actually going to miss out on the output. The people you'll be interacting with, meaning even your workmates and even your team and your patients, will experience the effects of the stress, because your output will be very poor. I've talked about poor service delivery, but also mental health issues, and finally, death. We've had actually even dental professionals, the young ones, also battling with drugs. Why? Because of poor stress management. So this takes me to this picture. This is a very beautiful picture that shows us what really happens to us when we are happy or not happy. So the question is, I want answers. So one is, you just write real or fake, okay? The question is regarding this picture. This is me, for those who didn't see me when I put the video on later. So this is the question, is this smile fake or real? So you just write real or fake. I just need like 5 answers for this one. And then I'll respond, okay? I'm looking for answers. Is this smile real or fake? Okay, I have real. Okay, any other person? At least 5 answers for this. Real, okay. I'm looking at more answers. Real, okay. This is interesting. So I want, okay, at least now I have the last 2 that have said fake, and they're the right ones. So I'm just going to surprise you that this photo was taken in 2021, and this was a fake smile. This was at the point whereby I was at the drown of depression. And so I went for a cabin kind of trip, but I still couldn't relax a bit. So at the back of the smile was a very depressed person. And what does this tell us? That the smiles may not necessarily indicate that someone is okay or happy, as we call happy. And I mentioned this, that smiles are our job, but we should not forget the one behind the mask too. It's only you that can tell whether the smile is real or fake. But also we have to also look at our team members, the people we work with, and also our colleagues. You may realize someone may be trying to adapt by trying to smile with everyone, but when at the back, the deepest of the closet, they're actually very depressed. So that's why it's not just a smile that can tell, but a lot more with a smile. That was just to remind you about that. So I know we have a mixture of young professionals and those that have actually worked for a very long time. I want us to understand that work is part of life and we can't go away from work. I'm not here to tell us to quit dentistry, but I'm here to tell us how we can work like how we can do our profession, but also thriving in other aspects of life as well. We have to look at life as holistic. It's not just one thing to do. And then also we have to redefine what success is to us. When I just started dentistry, success was basically making my patients very happy and excited after dental procedure. So that feedback was very good for me. As I started growing in the profession, I realized that people are actually rich in dentistry. So my success went into monetary end. How much should I have to know that I'm really successful? But now, as I've practiced more, this year is actually my 9th year into practice, then I get to realize, this is actually not it. It's the satisfaction that I get after working with my patient with all my heart, my mind, and my soul, and going back home, and I don't get a phone call to tell me I have pain. So our successes are different as a profession, and you have to write it down and know what is my success as a dental care provider. Then also sometimes stress helps us become better. So we can use stress as an advantage and not as a disadvantage, because some of us actually function better when we are stressed, because we probably now start working out things to make our lives much better. So the disaster is based on your response. After going through a mental health breakdown, I realized that my life had to balance. And nowadays, I'm actually a better healthcare provider because I do respect my life and I also do respect my work-life balance. I know when it's time to break it off. I know when it's time to work. And it has helped me become better at how to handle mental health issues. Also reduce the pressure, because progress is more important than perfection. For the young dentists here and the young professionals here, always when you leave school, since I teach most of the young people, I know what the pressure that comes in out of school. When you start, I know the pressure is high. You probably are scared on what to do. When you perforate a root canal, you feel you've failed. But the issue is, look at your progress more than the perfect you, because progress will be achieved over time, and progress will also make you a better professional and learn from your mistakes. Also feel every step of the climb. That's what the lady is doing there. Why? Because for us who have struggled to achieve particular things, you realize that when you achieve those things, the celebration is very short, because you're already there. And that makes us know that the feeling of accomplishment only lasts for a short time when you are at the top. So it's very important that you feel every step of the climb. Celebrate yourself when you have improved. When you're no longer perforating, when you've made a patient very happy, celebrate yourself. Look at your failures as points of improvement. And one of the greatest leaders actually mentioned that failure is the best teacher. But the pressure often makes us undermine our successes. And so we end up going along with the stress. And then I did mention that we need to stop trying to achieve something that is constantly changing. So we need to reduce the pressure and have everything perfect. and desire just to do our best. Every time we show up to offer services to our patients, let us just desire to do our best. You may not be perfect, but desire to do your best to make the patient comfortable. And in terms of solution, one is that also the other thing is we have what we call the general adaptation syndrome that we summarize as GAS. And this one basically phrases, how well are you sleeping? Ask yourself, for those, I know most, the Ethiopian population majority are Muslims, but some of you, are you taking alcohol? How much of it are you taking? When you're stressed, what are you actually doing? As a human being, are you eating well? Are you managing your schedule well? Are you having time to relax? All those are things you're supposed to think about. So GAS is actually a 3-stage physiological response to stress that was proposed by Hans Lai, and it has 3 phases involved. The first stage is what happens to our bodies when stress has come in. So the first thing is adrenaline production and cortisol release because of flight and fight response due to the body reacting to a stressor. Later, we get to a resistance stage whereby our body is attempting to adapt to the persisting stress and maintain normal function. So we try to basically resist, and the body is also trying to do the same. But at that moment in time of resistance, your body is actually highly alert, meaning that any kind of small irritation or provocation, you may be stirred up into the alarm stage. And after that, we go into the exhaustion stage. And this one is because of the prolonged stress. Now, this leads us to failure of our bodies to adapt, leading to depletion of the resources and body's ability to cope with stress. So we become typically impaired. And that's when we probably now start getting into addictions and even failing to achieve our targets and even breaking out of the profession and going into other things. So we should remind ourselves what really matters in the dental profession, but also respect those lunch breaks. I work in a place whereby we are a team, and I see some of us can work from 7:30 a.m. to 6 p.m. without even going for any break. Now, the problem we have is that we are making this money, but when you don't respect these small things, the money you're going to make, you're going to end up putting yourself in hospital. So that's why it means that take care of yourself. Even if you want to deliver services to your patient, respect the meal times, but also develop focus and engagement. Multitasking does not work for dentistry. You really have to find a way of dealing at one thing at a time. And I mentioned that a contented lifestyle is not necessarily directly proportional to your income. Much as you want the income, but also make sure that your success is not on your pocket alone, but it's on your general state of well-being. So we are going to go through this in the next few minutes so that we can have time maybe for questions. So when we are managing stress, as the World Dental Federation has suggested, so you can actually even get this toolkit on the FDA website. We manage as the individual first, as the dentist, then as the organization, then as the system. So for those who are in positions of policy making in your countries, you can also find out the national part. For the purposes of this presentation, I looked at mainly the individual, the dentist, and then the organization, because we fall under organizations, and some of us even own practices. So this is very important. So as an individual, it's important to determine, these are the 3 things you do. 1, determine if you're mentally okay. And then once you have determined whether you're okay or you're not, then you do if there's something wrong. And then the last part will be discussed. So we are going to start with the part of determination. Remember, we talked about the physiological manifestations of stress that I feel most of us really listened to earlier on. The pulse, the increased pulse, the butterflies, the pounding heart, and breathlessness, all these things. But also the other things you can determine, ask yourself, am I being able to concentrate well. Because mental health has a little bit of stigma, we have most of the people not able to talk about it, especially when they're struggling. So you're forgetting things all the time, even the little details, even in the procedure, you're not really doing things so well. You're worrying about the mistakes that you've made before and those that you anticipate to make. You're worrying about what your colleagues think of you, because probably one of the patients came back and complained. If you work in a place whereby there are many dental care providers, when you're sitting on your own, when you're back home, your mind is full of all the things you have seen at the practice, the patients you have dealt with, the procedures you have done. Already that means that you're already crossing the boundary. Also having difficulty in making decisions, losing confidence in yourself. You're even scared of what to do because you think you're incompetent because of one failure. So that is one of the things that you know that something is not right. We are going to discuss the do next and then the last part. So the do part is one, we as dental care providers should learn what we call relaxation techniques. What are these? Relaxation, the first one is what we call the quick relaxation. This one that you can do at your practice, even when you're sitting. You just breathe deeply and breathe out slowly between patients, because that causes relief from tensions. You can also close your eyes and just count 1 to 3. That is enough to cause a quick relaxation. You can even take a lunch or even go for a walk around. You don't have to sit waiting for the next patient every time. You can decide in between, as your chair side is organizing the surgery for the next patient, for you to walk around. Exercise should be routine, not to sit 12 hours without even getting up because you want to get your targets done. All right. Then we also have the other things we can talk about. I will probably first take you forward, then go backwards. What we call also the progressive muscle relaxation. Now this one, you actually lie flat on the floor, and then you allow each of your muscles individually to contract and relax. So you can start with your toes, then your thighs, then your buttocks, your stomach muscles, your shoulders, your upper arms, lower arms, the neck, the facial muscles, then the entire body. This one you can do at home because you may not be able to do it in your practice. That is what we call the progressive muscle relaxation. The other one is also the mindfulness-based relaxation. And this one means that you actually notice the sensations you're going through. You don't try to force to change them. For example, if someone has pissed you off, a patient has made you angry, you allow yourself go through that emotion, but after you bring positivity in the emotion and then you discard it after. But allow yourself go through it. Each time we struggle to probably fight a negative thought, often sometimes it causes instead an accumulation of more of the negativity within us. That's why it's very important. What is the goal? The goal is to increase awareness of the sensation you're experiencing to avoid additional struggle to change what you feel. So if in case you're probably affiliated to a particular faith, you can sometimes, when we use faith, to probably help us relax, like in the picture you see. The other thing I've mentioned is the eyes. You have to reduce strain on the eyes. We know we're always looking at our patients, but it's very important that you have adequate light. But also ensure that you have also protective eyewear during work. You can do what we call an eye rest. How do you rest our eyes? You just, every half an hour when you're working on a patient, you can just shift your focus to a very far object, and you look like looking through a window and be there at least for 10 seconds. It's long enough. That will be enough exercise for your eyes as well. Then the other thing that you can also do before we go to change of behavior is also reducing strain on your ears, because we work with a lot of noise. One time, one of the patients told me, there's too much noise in dentistry. Your instruments make too much noise. The handpiece itself makes noise. The ultrasonic scaler makes noise. So for us who are still using amalgam, the amalgamator makes noise. So there's noise everywhere. So you have to take breaks from high frequency noise, the handpieces, the ultrasonic scaler tips, and then also make sure that you also have some, we have now ear aids, whereby you put those gadgets in your ears as noise protectors, so that you're able to work without being affected in the long run with the noise from our places. The other thing that I've also mentioned is exercise. There is a lot to do with ergonomics in the dental practice. You should make sure that you're actually doing 400 dentistry, but also instead of bending at loops, to make sure that your vision is very clear. Make sure that you take regular breaks between procedures to stretch your muscles, the neck, the back, the calf, even your wrist. You have to take care of it. Dentists should know that exercising is very good after your work routine. Then also avoid adopting uncomfortable sitting positions, because if you're going to do that from Monday to Saturday, or whatever day of week that you work, and then you do it for all the years you're going to do this practice, by the time you leave dentistry, you'll have no back left. So it's very important that you learn the ergonomics quite early in life, and then you start working on them. So the point 3 of changing our behavior is basically, 1, analyze what you're doing. As dental care providers, we are supposed to have what we call the SMART rule, meaning have specific, measurable, achievable, relevant, and then time-bound targets for your health and well-being. It can be as simple as walking for 30 minutes a day for 5 days. You can see this is measurable. It's also achievable. It's very specific. And so it can also help you moderate your lifestyle, compared to just saying, I'm going to walk more. How are you going to evaluate the walking more after work? So when you set targets, they will help you. And you can start with just the small steps by saying, I'm going to walk twice every week for 30 minutes. Because this will be important for you to be very healthy and able to attend to your patients. And also the other thing is, before we go to the 5 Ds of managing workload, I want us to talk about the changing of thoughts. We have to change our thoughts from the unhelpful thoughts of us failing, the irrational thoughts that we always have at a procedure that has not gone well, to be more positive. When we identify those unhelpful thoughts, we evaluate them and see how they make us think. And after, we start what we call positive mindfulness, by writing the good things that you have achieved and the fact that all these are steps that are going to make you a better dental health care provider. So you replace every negative thought with a positive one. And now that takes us to the 5 Ds of managing workload. How do we manage workload? 1 is delegate. If this task that you're doing can be done by someone else, feel free to do it. For example, if you feel you're having 10 patients waiting for you alone, and you have another colleague in the practice that can do equivalently good work, feel free to delegate the task to that other dentist that is still sitting. When you sit and want to do everything yourself, in the long run, the time you reach the 10th patient, you're going to be extremely exhausted, but also your service delivery is going to be very poor. Then also break the tasks, which is divide. Break the tasks into smaller bits that you can delegate or be shared. Don't, like I mentioned, don't be a one-person's army. Work with a team. Have a person to do the reception work. Have a person to do the finances of the clinic. Have a person to chair side you, not to work alone. Have a person to help you, tell you what you have to achieve in the day, a personal assistant if you can afford them. Have work divided. Then divert. If probably there is any other way to tackle the problem, don't try to have it on your own. Here I said that if there's a team member that has probably mentioned that something is broken down, an equipment, get a system whereby there's a way to report emergencies to avoid others, but also find a way of regular maintenance so that this does not happen again. Then also in mental health, what that is very important is discussion and sharing your difficulties with colleagues. The challenge we have is most of us, we don't want to share our failures. You probably sit on it, think about it. You even think about whatever went wrong, but you don't share with your colleagues. Sometimes you can share an experience with someone that has worked for 15 years, and they will tell you that, no, this is expected. Also, me at this point in time, I had this. So we as the dental fraternity have to learn to share these experiences, not because we want to make you feel you're incompetent, but to also improve your thinking and help you become a dental healthcare provider that is actually providing a better service to your patients. So also the approach, when you're failed at something several times, feel free to ask someone more experienced to help. Don't try to fight Google. Now we have ChatGPT. Try to find things on AI to see how to do it. Learn to share experiences, but also learn to seek advice when things are failing. And also finally is to develop a system that is going to tackle mental health. And so that's what takes us to part 5 of making a plan. Actions to tackle stress. If the stress is becoming too much, please seek help. It may start with someone that you trust to even seeking real professional help as a dental care provider. But also exercise is very good for tackling stress, and also relaxation techniques that we have shared before. Discussion is very important because it provides practical support, and it provides basically advice and support when you're struggling with stress. Emotional support is also important. That is the empathic acknowledgement of impact of stress on one's life. We are here to help. I'm hoping I'm also here, but what I mean that people around you are able to help if you speak out. If you don't, no one will know what you're struggling with. So when we go to the organizational level, which is the last part of this presentation, for those who own practices, your organization should be able to have a work environment that supports well-being. By that I mean there are preventive mechanisms to make sure that people do not even go to the point of stress. I know we want to work a lot, but in case you have workers, please respect their off times, their leave days, because you will actually avoid a mental health crisis in your practice if you do so. Then also your organization or your practice should have proactive strategies. By early recognition that one of your team members is not okay, probably they are struggling, so there has to be a safe signpost at your workplace that someone can easily come and talk about the stress. Now, the challenge we have, at least in Uganda, is that stress is not considered as a real problem. They actually feel that really you cannot be stressed. We are hardliners. But that is a very wrong mentality, because stress is one of the things that can actually lead us to our grave much earlier, even in our productive years of life. So as a workplace, check your practice. How are your appointment schedules? You have well-designated appointment times for your patients and what you're going to do. How are the waiting lists? Are you sure that you can handle all of them and you're not just struggling to meet your targets? Because even if patients wait for so long, that will also be a problem. Look at the work patterns. You have a work-life balance at your workplace. Do all your workers have a time when they go off? Even you yourself, do you have a time you break off to go and just relax a bit? Not to go for a conference, a dental conference, but to just go and relax? Do you have an appointment structure whereby someone has to book an appointment before they come in? Do you have team members that help you divert and divide tasks the way it's supposed to be? Chaotic work patterns. How is your schedule like, for example, for Monday? Do you have a root canal, maybe full single visit as the first patient? Then you have a crown preparation as the next patient. Then you have an implant as the third patient. you realize that all those are very kind of demanding procedures, but they're following each other. So your system should be in a way that you have kind of breaks. If you're coming from a crown preparation, as an expectation can be like a cleaning, can be, your schedule should be in a way that it helps you relax as well and not make you strain your body for so long. The protective equipment, do you have the personal protective equipment, the ones we often wear, even the shield, the gloves to prevent those accidents in the workplaces, the kind of systems we have, the aprons, all that to protect us. Do you have all those? How is the ventilation and temperature control at your workplace? Do you have enough air? Because work hazards can come all the way even with aeration. How are your windows? Anything that supports healthy living is important to check, because all these are demands for you to have a very good mental health well-being of yourself, but also your work team. Then also, you have to have a control system and support system. And that means that how much control does an individual have into decision-making? What about the team? Are there things that the team can handle and not train one person to do everything? Some of us have one auxiliary staff. She's the receptionist, she's the cashier, she's your chairside assistant. Sorry, I'm using she, but can also be a he. Workload, is there a control on the workload? Can you say that these patients probably are so many for the day? We can have a system whereby we can still see them the next day. You're not losing money. The patient will also feel very treasured if they feel that you're giving them your whole attention and not rushing in to see the next patient. In dentistry, we are working towards maintaining our patients, not losing them. And the first nugget is being able to give all your attention to your patient, not waiting for them to go out and call another person. That's why if you have planned well, you're able to do this very timely and very nice for your patient. Your work patterns should also be well controlled, and the working environment should allow you perform your tasks very well. Let the basics be there that you need to use so that you don't have to strain. How is your system support? Do you have enough support for your team members, your doctors, yourself as an individual? Do you have people that are going to support you when you're breaking down? Do you have a locum dentist that is going to help you when you're going for those off days? Do not feel guilty to rest, because that's what most dentists feel. They feel guilty to go off work, but it's very good for your body as long as you've balanced it well. Encourage. We have dental professionals in these associations. We should, the executive members should also be able to encourage other people, even the young ones, so that they don't feel that they are failing at their profession, but to boost them and tell them that they can always do better. Also train availability, train people on also these things. I learned mental health from my master's as part of occupational health, but it's very good to train your workforce to be able to know how to cope with stress. Peer support is very important, especially when you have a small isolated dental clinic. Make sure that you're able to have people to help and support, especially those that are in your reach. Relationships in the workforce are very important. A positive work environment, open communication, especially when staff are getting tired. You need to discuss this, even yourself when you're getting tired, openly communicate about your stresses. I would not encourage any of us that owns a practice. If one of your team members is really stressed, please don't chase them. Don't make them sign a resignation later because they have complained that they are probably overloaded. Just find a system where they can be supported and helped instead of chasing them. And then we should always provide a learning versus a blame culture. For us working with young dentists, we need to teach them, show them how to learn instead of blaming them for their failures, because that will make them run away from the profession. The other thing is role, define roles and also maintain those roles. Make sure that you have teams that handle different roles so that they're able to be designated for those purposes. And in case there is any change, don't just call someone from their leave day or off day to come and work. Communicate changes very well, but in also a respectable way. Apologize in case you've distorted someone's leave, because most of us, if you're bosses, you sometimes ignore that. You just want to order someone to come from their off day to come and work. But how you respect and communicate that is very important. And also manage change in a way that is respectful to all your team members and also to yourself. So the other thing, what to do, one, make sure that you implement stress and mental health awareness for all your staff. Encourage and support healthy living for yourself as well and as a team. Implement regular team meetings with time protection. Don't make very long meetings because your staff will get exhausted. Also have a lead manager in terms of mental health purpose. You can even have a counselor at your workplace or someone that is maybe outsourced, whereby people can also get that mental health kind of counseling for them at the dental care practice. Also identify and train a mental health first aider for the workplace. Unfortunately, most times mental health can lead to suicide. That's why it's very important to also have a team to help you avoid all that. And then, of course, some people just quit work, not because you are not paying them so well, but because they feel they're so drained. And also adapt and adopt the framework for a crisis pathway for any mental health concerns. Yes, and the other thing also to note is that encourage at your workplace. I'm hoping that all of us have water dispensers. It could be as cheap as that. Have a water dispenser, not just for your patients, but also for your work team to be able to relax and also take some water. Also, lunchtime should be respected. Those schedules should have those lunch breaks. And also promote a bit of schemes of like cycle to work. You can probably even allocate a day after work in your practice for all your work colleagues or your team to do some workouts at the workplace. It's very good for their health. And then also consider those promotion of activities like mindfulness and things that help people think positively, because they'll, in the long run, they'll help you have a very good output of your service delivery to your patients. And then also, if possible, you can implement a suicide awareness training for the staff. It's optional because people are scared about suicide, but you can also have that. Then leaders and managers should practice compassionate leadership skills. Learn to listen if you're in a position of leadership. As a dental care provider, listen to your team. Don't just discard their minds or their complaints. Learn to be a good listener. And as far as possible, ensure that there is protected scheduled emergency slots so that your staff are not overwhelmed, that they end up working all the days of the week. Then also your workplace should have a point whereby your staff can also relax. It's not that you're going to be unproductive, but it also helps the work environment get much better. And I mentioned that there are wounds that never show on the body that are deeper and more hurtful than anything that bleeds, and that is the mind. And I also mentioned that even dentists need to flush out stress. Mental health isn't just for the molars. Thank you very much for listening to me, and that is the end of the presentation. I think I'm supposed to give back to the moderator. Not sure if it's Dr. Fazikawit or Dr. Abdallah. Thank you very much for listening in.
Thank you very much, Dr. Maria. It was a very valuable lecture, and I think we discussed a lot of it. Can everyone hear me? Because I was having trouble at the first. I want to see from the, yes. Thank you, Dr. Fasika. Thank you very much, all of you. I think we have covered a lot of topics about the mental health. The Dr. Maria covered a lot of it, and I think she make 1 hour and 16 minutes too much enough for us. And everyone, I think, he put himself on the table and watch how stress is going on and how he can manage the stress. It was a very impressive topic. Thank you very much. If I could make a little bit summary of what she said, and it was about mental health and the burnout. What is the stress and the burnout, from sources of stress, from where the stress is coming out, and also how to where is this psychological or manifestations of stress and symptoms of burnout, solutions of stress and management. There was a lot of solutions and tackling of stress. One of them was relaxing techniques. Exercise is very important also, muscle relaxation, adequate lighting when you are in the environment, workload. You have to also 5Ds, as she mentioned. You have to make, delegate, divide, divert, discuss, and develop. So I think she covered a lot of things. We will have also question and answer box now in chat box. If you have any question regarding this lecture, you can now put it on the chat box. I'm waiting our doctors if they have any question regarding our topic on the chat box, so we can read and Dr. Maria can answer. And I want also to remind you that we have a test quiz on the Ethiopian Dental Professional Association Telegram channel. It will be on the Telegram channel. There was a test there to get the certificate of this lecture. Is there anyone who is having a question about our lecture? Dr. Timam is asking us, please share your experience about patient scheduling. We might face difficulty in doing as you recommended because many don't adhere to schedule plan. We will answer one by one. Dr. Maria, you can start by answering.
Thank you very much. Sorry, I didn't had unmuted. So the first question is, I share my experience about patient scheduling, which you might face difficulty as recommended. Yes, if I don't. Yes, so I work under as an associate, one of the dental practices in Uganda, and we are about a total of the different branches, 15 dentists. So my experience is that we have a system whereby they book patients for us. So patients call in, there are people at the reception that book these patients. So I get my schedule the day before I come to work. And I see which patient I'm seeing early, what am I going to do, and then the entire day. So when I present myself, at the practice, I know that I'm going to see 8 patients. And in case by any time someone comes and they are not according to plan, I can only see them if I'm free. If I'm not free, any other dentist that is free could attend to the same. But we prioritize the ones that are on our appointment schedule. Yes.
Okay, doctor, thank you. And Ahmed Ishaq is asking also about how many patients per day the dentist should see.
This is a very difficult question because it depends on the kind of speed you have, and also the fact that you're balancing. Recently, I've personally, I may be seeing quite many because I'm also still young. However, the issue is not how many patients you're seeing per day, but the fact that you're able to take the breaks and have a very good kind of well-being. But also the other thing is, recently I had one actually who now only sees 4 patients a day, and that is it for him. So it depends on also your age, the coping you have, the cases you have. Sometimes you may only have to see 2 because the processes have been very long. So I don't want to cut this in stone on how many patients you're supposed to see. It's basically a number of factors that come together to help manage the numbers, also based on whether you've taken the break. The moment you work and you've not got out of your practice and you've gone elsewhere, meaning that the chances are high that you're actually overworking. So it also depends. And when you always feel when the pressure is too much, you can always relax and take that break, and you can always come back and continue working, as long as you feel you're balancing.
Okay, good. Francisco and Jenna is asking also about what's the prevalence of mental health issue among African dentists, and is there any study regarding this?
All right, thank you very much for the question. Unfortunately, most of the research in Africa has been very limited. So even when I was trying to check around and see what is happening in the African context, I should say I've not yet found data. Probably there are recent articles, I didn't find them because I only found basically the other continents like the UK, Canada, Africa, not. I didn't really find. But of course, it's probably more research, but also finding out more of what happened. There is an article that was actually written by Maraga, and it was talking about the dentist mental health and their challenges, support and promising practices, but really it wasn't going into the kind of balance rates. Yes, but of course, if we talk about the ones that posted in that study, how many of those mental health when they were dentists, they were actually 44%. So you can find that what has been done is little, but it can tell you where we are heading. And because also most of us do not talk about mental health, that's why we probably struggle from the same, but we're not able to present that when studies are asked or when research is made, because we don't want to be put as incompetent to practice. Yes.
Okay, Doctor. Bas Alinative is asking, would you encourage the young dentists to start their own private practices or to remain employed?
Okay, thank you, Dr. Pius, for the question. Young dentists, I would encourage you to first work under someone before you own your own practice, because one, it will help you get mentorship to become a better dentist and also improve your clinical skill, but also be able to understand the dynamics that happen with those that have worked for a longer time. However, once you've established your foot and you feel you have enough people that trust you to offer dental care services, then you can go ahead and start your own practice. But the initial point should be you first work under someone. Yeah.
Okay, thank you, Doctor. Abdulhamid is asking, how does mental health impact clinical performance and patient care?
Okay, thank you very much, Doctor, for that question. So the first thing, what happens is, because I remember I mentioned something about the boy that eventually becomes a cancer. So initially, it's when you're still at the early stages of the general adaptation syndrome, the GAS, is that your body is first of all responding to this stress. So at first, you may not necessarily kick to all the way to the part of resistance. So when the stress comes in, one, you will start getting anxious when you're dealing with your patients. So that means is that, for example, if you failed at one root canal because it perforated or the patient came back with an abscess, you'll be scared to perform any other root canal procedure. But secondly, when you see so many patients, for example, you've been working with no rest, your last patients are going to struggle with the kind of quality service you're going to give them, quality of service you're going to give them. Because most of them will feel you'll be working, but to work to finish. Even when you have many patients, you'll work to finish, and the patient will always feel that you're rushing on them. And that will always make sure that they will actually even go and look for another data that give them time. The same in terms of clinical performance. You realize the way you would have done a feeling when you've planned for it, and when you're doing it because another person is also waiting in queue, you may not be able to do it perfect because of the rush, but also because you're probably now struggling to battle getting more income versus service delivery. And what the patients need is our time and full attention as we treat them, being there in same space and time as we work on them. Yes.
Okay, Doctor, thank you. Margie is asking us, are patients also given hearing aids to help avoid the noise in the working area?
All right, thank you, Maggie, for the question. Right now where I work, we don't do so, but I think it would be something that would be a very good thing for our patients, for those who own practices, to consider that for patients as well, since the noise is also too much for the patients. But at the same time, also have patients that come with their own earpads and decide to listen to music in the process so that they don't hear the noise. But of course, that could be something we could consider as dental care providers, especially those who own practices, to also improve service delivery to our patients by providing those for them. Yeah.
Okay, thank you, Dr. Dr. Fasikawit is asking us, in what ways does the pressure to maintain clinical perfection and patient satisfaction affect mental health well-being, and how should we typically cope with this silent burden?
All right, thank you very much, Dr. Fasikawit. So the pressure to maintain clinical perfection and patient satisfaction is one thing, but one thing I did mention is you as a dental care health provider, don't look at perfection, look at your best. Do your best. Your best may be the perfect, but sometimes it may not be the perfect because you're still learning the skill. But do your best. When you do your best, the patient will feel that you have done your best. There is a time I always ask my patients for just those small things. I ask them, how was your experience before? Probably, if I'm just going to do a cleaning, I'm going to ask, how was your past? Have you cleaned before? And if you have, I would probably follow up with that question. How was your experience? And patients will tell you that, oh no, last time I felt like as if the dentist was rushing. I didn't give time for me to express how I was feeling. I felt like the dentist was pulling my lip. All that is probably something to tell you of what this patient expects from you as you deliver. So you may not necessarily deliver what is perfect ideally, but your best will also be very perfect for the patient because they'll feel that you're indeed doing great work. But also one of the things I mentioned was also training. Don't stop the CDEs. Have enough time to equip yourself with better skill so that you're able to also improve the service delivery to your patient. And so the moment you're able to know that that's the best I have done, it will also help you. And in case you're working on a patient and money is the first thing in your heart or in your mind, you have to reevaluate because you're going to end up treating the patient's pocket and not the patient's satisfaction. So always that is kind of a bit of tricky, but the moment you know that you're doing your best, that will be good enough. And later on, you still become a perfectionist, but because every time you choose to do the best you can for the patient. And then in case you feel that you're incompetent at one thing, feel free to consult and to refer. Your patients will always appreciate you when you refer. Because if you do not refer and you fail at whatever you're doing, the patient will feel that you're still an incompetent dental care provider. And so that is the silent burden we are having, because we are also failing to recognize that you don't have to be perfect when you've just, even those that have practiced for 20 or 30 years, they still make mistakes. The important thing is give your patients your best. Yeah.
Okay, thank you, Doctor. Also, all of you is asking us, one of the reasons that causes stress is the stress to the dentist is patients. What do you suggest to minimize stress from our patients' side?
Okay, I know I was talking about difficult patients and easy patients. That's why we also need all these courses to help us learn, especially even communication and customer care, because you can't run away from difficult patients, because we also meet difficult people in our lives. The most important thing is, one, even though you feel that you're the right and the patient is in wrong, it's always sometimes to take the loser's end by first of all acknowledging what the patient is complaining about. And after that, listen. Listen is very important. Allow the patient to express their concerns as you're listening. Try to address those that you can. But in case you cannot, also allow the patient to see someone else. Sometimes you cannot convince patients to like us. Sometimes you cannot convince people to be on our side. The best thing is you have done your best. Listening is very important, because if you discard the patient's kind of information, they will actually even not come back, because they will feel you're not attending to their interests. Remember here, they are patients, but they are also our customers, they are clients. They're the ones, one happy patient is going to bring you over thousands and thousands of patients. And one disgruntled patient will take away millions of patients from you. That's why, for the sake of your practice, you don't fight to win. Acknowledge, try to understand why they are stressed and get better. Apologize when there's need to, because sometimes we can't, fire cannot serve fire. So sometimes you have to apologize, but then also do your best, and also have a feedback kind of portal in your practice, whereby disgruntled patients can also put their feedback there without feeling that they're being judged. Yes.
Okay, thank you, Doctor. Dr. Fasikowit is asking two important questions. One is, how does the culture of professional comparison and competition about dentists contribute to stress, burnout, or imposter syndrome? And what systematic changes could shift this culture towards healthier professional development?
All right, so this is why this question is a very good question. Thank you, Dr. Fasikowit. So when you look at this question, it's talking about the professional comparison and competition. We face this everywhere, but that's why one of the things I mentioned is defining what success is and looking at yourself as the toolbox for progress and not looking at people around you. Now, the moment you stop looking at someone else working better than you would have won the battle of competition. If you look at, there's what we call positive competition, whereby you want to be like a particular person because they are good at their work. And so you even go to them to improve whatever you're not good at as yet. That is good. But negative competition is what probably kills everything in dentistry, because you're trying to be like someone else in all aspects of life, but you're also trying to put down others. The simplest thing that can even happen is a patient coming with a failed root canal to you, and then you start talking about how the other professional failed badly. That is already a very bad thing, because you also don't know whether your work will also be evaluated by someone else and also say bad things about you. First of all, we have to learn how to cover our colleagues. Even if something is not good enough, don't say it up front before the patient, because you will be defaming the other practitioner, of which that something would happen to you also, you don't even know. So the first thing is, one, we have to respect ourselves, but also cover ourselves. You can say, yes, something is wrong with what was done here, but don't say that the dentist did bad work, or the dentist doesn't know what they are doing. Try to cover them up and try to find a solution to help the patient, but don't show the patient how bad the other person is. And then also let us learn that we can all thrive as dental practitioners without having to pull down any of ourselves. what is most important is that our patients are happy and satisfied. A happy patient, whether you're good or not, they will come back because of the service you provided to them, the good service that you provided to them. That will be the main reason that's why they'll come back. So that is one thing that we have to understand. Imposter syndrome is basically, should be managed by the teams. In Uganda, we have the Ugandan Medical Dental Professionals Council governing controlling the medics and the dental surgeons. But I'm hoping that in other countries as well, there are systems whereby there's a kind of report system for imposters, and where that the associations can also contribute to picking out these people that actually affect the culture of the service delivery by imposting them and making themselves be other people as well. But also you can make your own name. And the only name you make in dentistry is providing good service to your patient. The patient will always come back because of the experience they had with you. This is a profession whereby whatever we do is what promotes us. We don't have to advertise. Your service will promote the people that are going to come looking for, and also will refer many of those. So hopefully this can help us shift, but also I'm also encouraging the associations to please have mental health as part of your kind of awareness as among your professionals. It's very important, and it will also be helpful for them to understand, especially the young ones and also even the old professionals. Yes.
Okay.
Thank you.
Thank you very much. The second question is, to what extent do social media and digital platforms exacerbate feelings of inadequacy or performance anxiety among dentists trying to keep pace with their peers, clinical achievements, and lifestyle portrayals?
Maybe you could repeat the question, sorry.
To what extent do social media and digital platforms exacerbate feelings of inadequacy or performance anxiety among dentists trying to keep pace with their peers, clinical achievements, and lifestyle portrayals?
All right, thank you. So social media is something that has come, and we can't really run away from it, because even our patients Google, and we have a lot going on, and TikTok and all those things that happen. But remember, just to tell especially the young people, that social media and digital platforms, people only share their wins. They don't share their failures. So whatever people show on social media should not actually intimidate, because they're only showing their good sides. I also do the same. I don't really share my dental work on any social platform, but I mean, if in case I'm to share my good times of my life, I only share the good things, not the bad things. So if you sit down and hear from the older professionals that have worked for a long time, you get to understand that all of them still make mistakes. All of them still error, all of them have failures. And just listen, and this pressure from the social media and what people's, what the peers are saying they have achieved, you can also get one or two things to learn by also improving on your skills if you have not yet, but let it not be a point of making you feel that you're inadequate. Yes.
Abdul Hamid is asking, is there any policies or systems be implemented to support mental wellness in dental setting?
Are there policies or systems
be implemented mental wellness in dental setting?
Yes, FDI has it has a toolkit. It's not really at policy level, but it has a toolkit of how you can support mental wellness in the dental setting. And probably you can check out the FDI website for mental health. It's very helpful. You can adapt it. Unfortunately, in most countries, it is not there because they only talk about general mental wellness. But you can use, in case you're at a point of policy making for your country, you can use the FDI one to make a draft for your country, and maybe discuss on how that can be implemented in your countries. Yes.
Okay, thank you. Dr. Tamam Kemal is asking, what's the recent recommended maximum time duration of patient chair side?
This is a good question, but also kind of a very tricky question, because in dentistry, chair side time is dependent on so many things. Even coming in with the procedure that you're doing, some procedures can never be the recommend, probably can never be 30 minutes per se. Somebody else should always be like 1 hour. But I should say that ideally, if you can do very good work for simple procedures, I mean, talk to the patient. And remember, the first part of the treatment is creating a rapport with the patient. Now, when you're creating a rapport with the patient, you won't be timing how many patients you want to stay in the chair. And so, but if it is a simple procedure, 30 minutes should be enough to make the patient to do the simplest procedure, but also give time for the patient not to feel that you're rushing them out. But for other procedures, really, it is patient selection. By that, I mean case related. By that, I mean the patient may come, they're elderly, you have to listen, because old people want to really talk. You have to listen and give that time. So they may even take longer than normal. You don't necessarily have to do a lot on the first day, especially if you wanted to hear from the patient. So this is a bit kind of tricky, because different procedures will require different time. Probably an implant may have to book an hour, especially if you're learning, even may have to book like 2 hours. So it depends. I don't want to give a clear specific time, because it is per procedure.
Okay, Doctor. Doctor, I think will be the last question. Dr. Moran, the president, is asking, I want to know what role do professional dental associations and workplace leadership play in their reinforcing or mitigating the pressure to conform the high performance norms, and how can they actively support a culture of psychological safety and authenticity?
Thank you very much, President Dr. Meron. I think what is being done in one of the universities here in Uganda is what we call the mentorship, whereby the senior professionals have been in the practice for a long time, get their students. Each mentor is connected to one young professional, and they help them understand the dynamics, but also consult when things are getting bad and help them grow in dentistry. I feel like all associations, even with the Ugandan Association, should find a way of bringing this mentorship program for the senior people that have practiced for a long time. I've also just practiced for 9 years, of which those years, some of them have been studying. So they may actually be less when it comes to clinical exposure. But the important thing is discussing, having that kind of pool whereby the association provides the young people that are just joining these associations with mentorship from the senior people that have worked for so long. A space, we can even, association can also get that those psychiatrists and the psychosocial teams that are well trained to support those that are struggling, or even create a kind of communication line where people can always run to when they are struggling with stress, and a safe space, even a space whereby they can complain about their fellow professionals that are trying to put them down. So it should also kind of be there, but also the senior dentists can also learn from the young ones. So the association should provide this, and more of the CDEs as well, to help create the awareness that also a dental professional can struggle with their health mentally, and even stress alone is kind of like the first spark that can lead down the road of mental illness. Yes.
Okay, Doctor, thank you for your time and your valuable lecture. Before closing, I want to thank you very much, you, Dr. Maria, and let's give you the last word you give to our fellow dentist that is now hearing you, our audience, about the mental health. Can you give us 2 or 3 words, last and final? Okay, I want to thank the participants, the audience, Ethiopian Dental Professionals Association, to their time and their valuable time. I want to remind you, all of you, that we have a test quiz in the Ethiopian Dental Professional Association Telegram channel. It will be 3 hours away from now. So you have to take that quiz. And also, I want to remind you that we have in next session on August, I will be presenting there an important topic about infant oral mutilation, which is a barbaric habit that is our people do it in East African generally. So don't miss out. We will share it in our social media. Thank you for your participation, and thank you all of our team from Ethiopian Dental Association. Thank you very much.
Thank you, Dr. Abdallah. Sorry, I had not unmuted, and I was trying to unmute myself. My final word to all the dentists, thank you for joining in. And my last thing is basically to say that love your life so much that you're able to take care of it in terms of priority. Yes.
Okay, thank you. Thank you very much, Dr.